I'm going to ask you, you know, what you recommend to your patients and in which situations, and also just, maybe we could start with the pre and postpartum.
Sure. So I recommend Damiva Mae, right away, just because I feel that even if women are taking hormone replacement, they're only doing it a couple times a week, and there can be periods of dryness in between. Typically that's how it's used. So I think that that's very helpful. Mae is very helpful to moisturize and make women a lot more comfortable.
That's awesome.
Yeah. And I also recommend the Cleo or Cleo with CBD if they're having vulvo vaginal symptoms, which is very common also in a situation of pain, postmenopausal, perimenopausal pain. So I do recommend both, actually. And, just hearing your comments on how much to use them is helpful because, just to help me guide people a little bit more on that.
Sure. And how about sort of pre and postnatal?
Yeah. So there again, I might end up recommending both. I guess that's another question though. If a woman is breastfeeding, again, I would tend not to recommend Cleo with the CBD.
Yes. That's right. For the pregnant and breastfeeding women, there are very few studies. In fact, I couldn't even find one study that I viewed as an adequate study to evaluate the benefits versus risks of CBD usage. There are a lot of anecdotal studies. So, trials of 12 people, 20 people, but there isn't a longer term, multi-center randomized trial that shows, okay, if you're looking for this particular outcome and you're using CBD, then it's better than placebo or anything else.
Yeah, so there's no strong evidence yet.
There's no strong evidence right now that CBD benefits a woman during pregnancy or during breastfeeding versus the risks.
Yeah, good. Okay. Yeah, so but definitely the labial balm, Cleo, if they're having, especially if there was somebody who in the past has had vulvovaginal symptoms, it often comes on again and sometimes stronger during pregnancy or postpartum. So I definitely would recommend that. And the Mae as well. Because sometimes women do have those hormonal changes that put them in a situation where they are feeling some dryness or discomfort.
For sure. And how about perineal massage? Do you do perineal massage on women
Oh
prenatally?
yeah, definitely. And yes, that can be used. That's very nice for that as well. Yeah.